Okay, good afternoon. Our lesson for today is about physical wellness. So actually, it is just a continuation of our lecture discussion last uh, term. Okay, so we're going to pick up now where we left last midterm. So physical wellness consists of numerous components, including but not necessarily limited to medical wellness, pharmaceutical and drug wellness, nutritional wellness, aerobic capacity wellness, muscular fitness wellness, and flexibility wellness, and body composition wellness. So have you noticed in our last discussion, these terms are already there, but it is those terms are and their discussion there is more on the physical fitness coach or instructor. It is not the term that they are using is not the physical therapy word or physical therapy realm. So don't be confused with the term that is used here, especially pharmaceutical, drug, medical. It is quite similar. Let's take, for example, aerobic capacity, that is refers to cardiorespiratory uh, wellness in fitness level, cardiorespiratory fitness. Then you have you there also muscular, wherein you have the tests there when it comes to strength and endurance, diba? Ano siya? So similar lang na sila. But here, we'll be focusing it more on the PT side. So let's start with disease and medical wellness. So disease and conditions are dynamic. So when you say dynamic, they are evolving. No? They should be considered in terms of wellness rather than solely on health. So inana siya. So medical wellness of a patient or client is determined by her or his knowledge about it. So that's uh, medical wellness. And how do you know with how much do you know about your disease or your illness or your sickness? Then that refers to medical wellness. Okay, and his or her commitment to it in his and her or his related behavior. So how would you react? So with that sickness is now that is comprises the medical wellness. Knowledge about medical wellness includes, but not is necessarily limited to knowing risk factors for diseases, illnesses, and conditions. So, dili lang siya, it is not only limited to knowing all these risk factors and also, as the previous definition, how are you committed to this and what is your behavior regarding these conditions, especially these risk factors? So, are you willing to prevent, lessen the severity, or you want to be cured or healed? So, medical wellness includes tertiary prevention. Now, tertiary prevention is defined as wellness for those with a chronic irreversible condition. However, medical is wellness is not related to whether a person has a disease. So, it is not only limited to a person with a physical disability or a problem in his health. No? So, inana siya, no? Medical wellness. So, concerned siya sa tertiary prevention, which is already on the maintenance and the improving the quality of life or function of the one suffering from that diseases. So, again, uh, uh, from the last statement that medical wellness is not related to whether a person or whether a person has a disease. So it goes both ways. Now, a person may be free from medical diseases or illnesses, but it's still medically unwell. When you say unwell, still uncomfortable with his body or with his physical stability or physical status, no? So inana siya. Or vice versa. It could be nga Physically, he is suffering from any disease, from a certain sickness, but yet he feels that he is medically well. You know? So again, because of the behavior towards that disease, no? Because it comprises the overall, no, overall status of the patients. Okay, why physical therapists should possess an operational knowledge of physical wellness? Why it is very important for us to know operational knowledge with regards to physical wellness, especially involving certain conditions of the patient or physical conditions of the patient. Because we are focusing more on restorative, di ba? We talk of if the patient is medically unwell, siya physical maladies, so we need to restore his health. So if they have that impairment, physical impairment, so physical therapists should help their patients. So we need to help them to enhance their physical health by educating them about physical wellness and as indicated directly addressing their physical wellness deficit. So inana, so kinahanglan natay kahibalog yun kay ano man, importante kayo kay kung unsa to ilang deficit mo ta tong i-treat, no? Of course, we can no longer treat the cause because it is already there. So what we need to do now is what are those deficits that we could develop in order to enhance their quality of life. No? So that is what we call physical medical wellness. Then let's go to pharmaceutical and drug wellness. Now, pharmaceutical are both prescription medications such as kana siya, mga prescribed meds, no? As we all know, some patients becomes dependent to these medications. No? Pain medications, commonly pain medications, no, they get hooked with that. Or sometimes, aside from pain medications, maybe they are hooked on kanang mga pampatulog. No? So, yan na, sleep well, kay na sila insomnia, di sila katulog kundi kay inom. So, they get hooked on that uh, drugs. No? But not only that, there are a lot of drugs that are legal now sold in the market wherein people are hooked. So, example of that is alcohol, tobacco, and caffeinated beverages. These are legalized drugs. Coffee is among the most commonly used legalized drug in the world because, well, you could get high when you drink too much coffee. At the same time, it could result to injury because your blood pressure increases and eventually it will lead to stroke. No? Alcohol is a legalized drug. That's why there's a limit on the amount of alcohol that you can drink. Because if you go beyond that, you are already you have now physical, you have lose control of your uh, movements, no? Di nakaka-control sa imong movement, ana, no? Although consciously, you want to do it, but physically, ang coordination, wala na, muscle strength, wala na, kay, again, because your brain now is intoxicated with an excessive amount of alcohol. So, drug wellness is determined by patients' knowledge about it and each commitment and the related behavior. So, kung sa may behavior niya with regards to these drug addictions, no, na ginahok niya, is he willing to give it up? Willing to stop, to cease from smoking, to stop drinking, or stop drinking coffee? So, kung sa may iyang kung gusto, no? Can he overcome the withdrawal syndrome? So, in terms of behavioral component, satisfactory pharmaceutical in drug wellness includes abstinence from illicit drugs and tobacco products, not abusing prescription or over-the-counter medications, abstaining from or not abusing alcohol and caffeinated beverages. So, are we capable of doing that? Or if we are the patient, now if we are the one facilitating for the patients, are we knowledgeable enough on how to teach the patient to overcome this problem? Do we have the basic knowledge on how to stop or to give instruction to patient on how to cease from smoking, to cease from drinking alcohol, to cease from drinking coffee? So we need to have those basic knowledge. So this is time that makam in na dayon ang ato ang basic counseling. Now this basic counseling, uh, we will be using now those basic theories, no? Katong mga katong ato nakatunan before, di ba? You have your pre-contemplation, contemplation, then maintenance, di ba? Na ito siya. So those are the basic knowledge that we need, no? Na other theories that involves the self-determination theory, na uh, health belief model, um, motivational interviewing, yung mga model, wherein we could use this theory to help the patient on how to stop or how to um, ease their bad habits. Okay, so physical therapy patients, clients present with impaired drug wellness. So drug use can cause a person to require physical therapy. For instance, excessive alcohol consumption can lead to stroke or fall. No? So kung ma-stroke, weakness, ba? Kaya magka-high blood man na, no? Kasi inom, especially inom kag tanduay, no? Na kay hypertension, automatic magtaas na imong BP. No? Kung beer, dili kaayo, dayon-dayon, pero again, slowly it will develop. No? But aside from that, you will also be risking yourself with other injuries or other problems such as liver problem, no? Or even ulceration sa stomach. Lainom ka, wa ka, o hindi, o ka-ulcer gina. Dagang ang problema. Oo. Kung nag-drive ka, tumbang motor, bali ang kamot, so you are now required to go under physical therapy. Ano man, o say hinungdan na, lahubog man, di mo nun, tumbas motor. So, yan ha. No? Physical therapists also provide care those who have used illegal drugs and become affected with the disease such as ana. So, mga drug-dependent individual, they become what? Infected with HIV. So, of course, mo present na dayon ang ilang problem, dili siya as HIV, no? This is drug-dependent. Eventually, mo present na siya ang problem niya secondary na, no? Secondary due to drug dependency. Kaya simple nag-share sila sa needle, so na-infect siya. So, ang problema niya karon is maybe sarcoidosis, no? Lung infection. So, respiratory therapy ang hatag sa iya. So, because while no one can reverse the disease or state of this patient, we could in did enhance their wellness through their physical therapy session. So, wala, no? Kay so ana Diba? So di na nato ma-reverse ang ilang sakit, pero atong ma-enhance ang ilang wellness through their physical therapy session. Ma-improve nato ang ilang quality of life. In some cases, physical therapists provide direct intervention for the drug use. Primary example, smoking cessation. So, muna nag-ingugay na, it is necessary for us to have the basic knowledge on how to give counseling, on how to stop smoking, how to stop drinking, no? Inana. So, to increase your confidence about providing smoking cessation or drinking cessation or drinking caffeinated drinks, it is helpful to enhance your understanding of the addiction process. No? So, kinalang ko, no, uh, kahibaluta sa naitay igong or atong ipalambo ang atong kahibalo mahitungod sa ilang addiction process. No? How they get hooked. So, inana siya. So, usually, sa mga inani, it starts from depression, ba? Labi na sa mga mahilig sa alcohol or mahilig panigarilyo. So it starts from depression, stressful work, inana kay di ba basic nila nga reasoning if they are going to ask them why they are drinking, why they are smoking. Some of them say work related because of the stress of the work or sometimes because they are depressed when it comes to their family. So inana. So magyapon na inom sa coffee, no? Tungod sa ilang trabaho nga na puro gabi walay adlaw. So ana siya. Then you have your nutrition and nutritional wellness. So nutritional wellness with regards to the food that we eat, no? And uh, how committed are we and is our behavior really, what is the behavior of that patient towards that problem, no? So towards nutrition that his or her at taking, no? Kung sa iyang behavior and ano. So okay ba sa iya ha ang calories nga gina-intake niya, vitamins, minerals, okay ra ba siya nga mamahaw siya puro rice, ya unig udto puro sudan, inig kagabi tubig-tubig lang siya, mo na iyang behavior or dili siya, no? So that includes healthy and unhealthy, no, nga mga nutrition ni iyang gawan. So sa iyang behavior. So once we know that, that includes also alcohol and caffeine consumption. So once we know that, then uh, it is very easy for us to educate the patient and give a alternative, no? Alternative para sa kana niya mga problema para ma-attain niya ang iyang nutritional wellness. No? Then you have your body compositions and body composition wellness. So how does he feel with regards to his body composition? Diba? Yabang disposition siyang life is happy na siya sa inana niya nga body composition because there are some individuals that even if they are thin or not fat, yet they are not yet they are not happy with it, no? Diba? Dili sila satisfied kay gusto pa gyud sila maniwang, so that is already mental disorder, no? Sometimes those who are fat are the most happy people, no? Mas malipay noon sila kaysa atong healthy, no? So because their behavior towards that is always positive, no? So when you have that kind of patient na positive siya, happy, mas sayon siya i-treat kaya nga naman positibo na gani siya sa kana nga aspect niya, overweight siya or niwang siya, how much more kung mahimo siyang healthy, no? So inhana sad, di ba? uh, so but it does not necessarily mean that when you are thin you are healthy, no? Dili. O kung dili po necessarily may nga kung tambok ka, healthy ka, or dili unhealthy ka, dili sad. So dapat balance mo ganun siya, no? So because when you talk about body composition, you need to measure the amount of the leanness, no? So it doesn't necessarily nga dako siya, tambok na, daghan na siya fats now. Dili. Okay, again, you have to measure. No? Kung niwang siya, gamay siya fat, pero nga ano matingala kapag pagpa-laboratory nimo si iya kay ay iyang blood pressure kay ni abot magkuan taas man kaayo. Niwang. No? Kung taas og cholesterol. So, di ba? So, ina na siya. So, physical therapy patients present with impaired nutritional fitness and body composition wellness. So, many physical therapy patients, clients are deficient in nutritional and fitness wellness. So, many of the patients, especially those who are suffering from stroke, traumatic brain injury, uh, diabetes, fracture, no? After magpa-PT sila, no, they suffered from nutritional deficiency, the same time body composition illness. Ano man, well, wa man gud sila gi-advise ano sa iyang kaunon, no? So pasagda lang sila. No? So ano man, labi na kung naka-out na sila sa ospital, no? It's okay where they are still in the hospital because of course na ay dietitians that checks their diet on what to eat and it is being served every day no sa ilahang meal, but once they are out in the hospital, no one monitors and no one also prescribe nutritional therapy for this patient. So balay ginahatag nga mo ni mo kaunon sa balay mo ni mo na kay ang doktor may ano man siya nga kauna tanan o ana raman, no? So sa PT mo na kasagara ilang patient maadto didto tingali sila nagniwang nanambok no maayo nya stroke nya di katindog nya tambok kaayo na siya no sa ni mo pag-aswat, no? Yeah, mag-muscle stimulation pag yun kasi ihan niya kahit na fats as we all know nga ang fats is insulator man na so dili yun siya kaka-stimulate sa muscle pero ikayo, no? So physical therapist has the necessary expertise then she so if the physical therapist has the necessary expertise he or she can perform indicated nutritional fitness and body composition wellness examination and the applicable evaluation, determine the conditions and describe the prognosis and prepare a plan of care and goals. So if you have now the basic knowledge honey, then you can make now aside from that no in examination so importante to siya katong unsa man to uh, mag-test sa body compositions. Yan ay caliper method, na ay bone scan, na ay isa to, uh, submersion sa water or water immersions, na to siya bioelectric impedance, di ba? Na to siya. So, of course, ang pinaka-sign out it katong bioelectric impedance man, no? BEI. Sayon raman to kay do raman siya paguniton nimo. So kung kabalo na kadayon sa ihang status, iyang body compositions, of course, ma-record po nimo ang nutritional kwan niya, di matanaan nimo sa lab o sa iyang problema o sa imong assessment, makita man na nimo physically. Let's take for example, kulang siya water, kulang siya vitamin C. No? Makita man na nimo sa iyang skin, sa iyang mata, no? O sa iyang gina-record ni iyang pagkaon, no? Makita man na nimo dito. So you could easily now make a plan of care, no? Suggest to your patients, to the third party or to the member of the family that this is the one that should be the patient eating. Okay, so inana. So qualified physical therapist may provide the indicated intervention directly or supervise another healthcare practitioner to provide them. So you could refer, no? So kung pananglitan dili ka expert sa dietary o sa diet, sa mga nutritional therapy, familiar, then you can refer your patients to the nutritionist if there is a nutritionist available or dietitian. So, i-refer nimo dito. So, yeah. So, dili ka expert. So, inana na. Kung wala ka kahibalo, bisan basic lang mga nutritional kuan, no? Basic knowledge sa nutrition. So, kung wala agad ka na, di, kaya ang imo lang, so, sige lang, una, no? So, kung sa'yo na-adra, mura na ikaw una. So, if you're like that, then you can refer it to the expert. Aerobic capacity and aerobic capacity wellness. So aerobic capacity wellness is determined by patient's knowledge regarding the 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 wellness of the respiratory system. No? That includes also sa mga VO2 max and also the oxygen respiration or uh, so inana siya. But of course, its relation also. So of course, diri mo sa aerobic ano dili na po na siya masulod ang not only that imong kuan no? Masulod gyapon to siya katong drug dependency, especially katong mga legalized drugs. Dili masulod ang smoking, how smoking as is, no? So it's very important. Kaya usually related naman din sila tanang wellness. So aerobic capacity is also known as cardiovascular endurance, describe the functional status of cardiopulmonary system. So that's why in our last discussion in physical fitness assessment, you have there 1.5 mile sa to siya, walk test, diba? Dito ang method kung sa pag-measure ano, this kato siya nga test is for cardiovascular, diba? Cardiorespiratory, no? Ito siya nga test. So, dira siya gana measure. Then at the same time, you have also your because this is aerobic capacity, ma-involve gyapon diri ang oxygen saturation sa imong blood, no? Kay VO2 max man, VO2 max consumption. So you have also other devices that needs to be gamiton, no? Para ma-test ang imong oxygen saturation sa imong blood. So you have your pulse oximeter. So this refers to the maximum volume of ang aerobic capacity. Wellness is determined by his or her maximal oxygen consumption or VO2 max or the maximum volume of oxygen that the body can consume during intense whole body exercise while breathing air at sea level. So, mo nang importante ito siyang pulse oximeter kay i-test man nimo dito. So, muscular fitness and muscular fitness wellness. No? So, in muscular fitness, is one level's strength either generally to a muscle region or specifically to an individual muscle. So, there are several type of muscle fitness. So, muscular strength, di ba? I-measure siya nimo sa ganitong ginagamit natin to measure. You have your 1 RM, di ba? For muscular endurance, naagyapon siya dito, no? For power and elastic strength. So, nani siya yung mga description. Ang muscular strength is the force exerted by the muscle or a group of muscle to overcome a resistance under a specific set of circumstances. So, mo siya, kung ang imong maximal strength siya is ina-measure using 1 RM. Then, you have your 10 RM. Diba? Itong 10 RM sa, paano to siya, sa imuhang endurance. So, uh, muscular strength is determined by the ability to move a heavy weight a limited number of times. So, muscular endurance is the ability to sustain muscle forces repeatedly or to generate forces over a period of time. So, gaan lang siya, diba? Diba sa imuhang, diba sa imuhang Tera X na kay DeLorme and sa gani na Oxford, diba? So makuha nimo siya iyang 10 RM nganong i-reduce man nimo siya diri sa gamay. So then maximum repetition. So inana siya. So you are measuring for the endurance. So muscular endurance is determined by the ability to repeatedly move a lighter weight. Okay. Muscle power is the work produced per unit time of a product of strength and speed. So muscular power is determined the ability to move the heaviest weight as possible. So kana siya. So when you say muscle power, uh, ano siya yung ability nimo to pick up that object and to lift it, to move in that area with a little amount of energy, no? Kanya matransfer pa gid nimo siya og unsa ka paspas, no? So it involves speed and strength man. Na lift nimong heavy object nga gamay lang ang gi-spend nimong energy at the same time with a less amount of time. So nana siya ang muscular power. So elastic strength is determined by the muscle's ability to exert forces quickly and to overcome resistance with a high speed of muscle action. So elastic strength is important in explosive activities such as jumping and sprinting. So diri na masulod dito ang imong flexibility and agility, no? Dito sa fitness, diba? Kay burst, jumping, and sprinting. Man. So elastic strength is determined by the ability of the muscles to overcome resistance and fast contraction and thereby enable the patient client to compete in a sport without injuring the joints or muscle. So flexibility and flexibility wellness. So flexibility is defined as the ability to move a joint or series of joints through the full range of motion, pain-free and unrestricted. So that refers to flexibility. So physical wellness affects physical health. That is very obvious. Kaya kung dili ka well physically, of course your health will be also affected. Diba? So bahalag wala ka tuod problema sa physical health pero sa imong huna-huna na kay problema so eventually affected gid nimo siya no. Magluya ka, di ka ganahan, di ba? Mulihok, magpuyo lang ka. So, physical wellness also impacts a person risk for certain disease. So, inana. So, siyempre kung di ka physically well, uh, at risk ka sa mga sakit, hypertension, sama, diabetes, obesity, so, inana ka. So, heart disease, so, inana. So, aerobic capacity wellness, no? Na siya dito. So, magkasakit ka sa kasing-kasing, kung dili ka magsige sort of effort, sige lang kaglingkod, no? So, you're inactive. Pharmaceutical, of course, affected niya pong ka sa health. Kaya, siyempre, drug dependency, alcohol abuse. So, unsa may resulta niya. So, pala inom ka, liver, stomach, no? Ulcer, stroke, sa pagyod, dementia, Alzheimer's. Kaya, siyempre, ang brain ni mo, ang mga cells ni mo mamatay. Or kung panigarilyo ka, di risk ka sa cancer. Okay, so inana. So physical wellness is also linked to mental and social health. So kung physically dili ka healthy, dili ka well, so nabi kay mental health issues usahay. Depressed and anxiety, insomnia. So these are example of problem nga mo come up nimo kung dili ka physically well. And also can affect the ability to engage in progress in physical therapy. So, di ba? So, unsa nimo pagkuan kung makita nimo siya nga kinahanglan nako di siya patindugon pero kay bugat man siya kaayo. Oh, so, unsa nimo pag-progress nga di man nimo siya mapastand with assist. Kay with maximal assist man ka. Organ fracture siya, dugay kaayo siya nimo patindog kay bugat. So na kay tendency nga basi ma-re-injured niya ang nag-heal na nga fracture bone. So di mo makontrol. No? So physical therapy practice expanding into the fitness and wellness arena. So ana siya no, ang atong practice as PT nag-expand na siya. No? The times, the times they are changing. So naga-change na siya karon. No? Di sa una, inani lang ang atong coverage, no? Mao ni current status sa ato ang practice as PT. A portion only is related to fitness. Ano man dili man ta ganahan nga ng mag-appeal ta ng mga exercise, mga konting ano mo nga may ko nagsakit ko, diba? Nga kana para siya sa mga gym instructor dili. So this is the current status. But ang future, ang proposal, it should be like this. Nga ang fitness and wellness should be under the PT. Ana siya. So means nga ang coverage na to aside from those restorative, maintenance, preventive, so when it comes to physical health na ato dira mosulod pag yun ang fitness and wellness. So ang atong arena or ang atong place of practice nag-expand siya, no? Dili lang siya kay ina nira. So physical therapists should possess, so this is an encouragement, a basic knowledge of nutritional fitness and body composition wellness, and the ability and willingness to critically analyze the wellness information she or he has obtained to ensure that it is valid and reliable before applying it in the therapeutic realm or sharing it with the patient. So, manang importante kaayo ang basic assessment na pag-interview pa lang nimo sa patient, pangutan-on nimo siya sa tanang aspeto sa iyang kinabuhi. Magsugod ka diri sa what, where, when, sa iyang injury, no? Kasi supposedly mao man gyud na siya kay naabaya tay lifestyle dito, di ba? Lifestyle evaluation. But at sa present stage, ang atong lifestyle evaluation is limited only to smoking, alcohol, diba? Uh, class of personality, no? Kung type A, B, or C ka, ana siya din sa pag andra siya mostly, no? Wa gani na ta ginamonitor ang sleeping behavior, um, unsay pagkaon niya. Kay sa atong feeling dili na siya part nato. Kung naa siya hospitally admitted ang patient, inpatient, that's okay because well, their diet is being monitored by the dietitians, by nutritionists. But if they are OPT, we need to evaluate these things. Kaya ano pa, wala na may ga-monitor nila. It's only their siblings, their children, or their partner in life mo rin naga-monitor sa ilang ihang pagkaon. Ba? Or yaya, maid, mo na. Ba? So, dapat kita i-assist nato na siya. Okay, kani siya nga mga kategory ganing wellness and fitness dito ni siya mosulod sa lifestyle, no? Quality of life man, functional. So dito na siya mosulod sa lifestyle na assessment. Okay, so supposedly atong lifestyle assessment mo taas na siya, no? Then adto dadayon ta dito sa other nga assessment area, ano, medical history, so pag ginadara. Of course, medical history dito na siya sa medical, no, aspect na ama na siya gid part na siya sa SOAP nato. But of course, ang reason magud na sa present time nganong inhana ra siya kamo po ang ato assessment kay because we need to be specific, no? Mao na rason yun usually nga ginaiban kay let's say for example kay fracture man ni siya. So, fracture lang nga assessment akong gamiton. Diba? Ana raman. So, akong i-assess ang man kung fracture. So, i-assess na ako. Na ba say nerve injury na, ikuan, na. Dili na ako mag-mind atong unsay gikuan kaon niya. But remember, kung unsay giput in mo sa iyang ba nutrition nga kwan, that will affect the healing process of the bone. Diba? So, kung dili mo siya ma-assess, di mahinay ang pag-heal sa bukog kaya naman kulang man siya nutrition. Naday siya nutritional deficiency sa calcium. Kung nang nagka-fracture siya, kung wato nimo ma-assess, na supposedly kung na-assess to siya na plan of care ka nga sa mga food ang imong ipakaon niya, i-advise niya, kauno niya para makatabang nga ma-heal ang iyang bukog para mupaspas ang progression sa inyong physical therapy session, no? So inana siya. So physical therapy, wellness therapy should type of physical therapy, no? Kaning just like with other physical therapy, kaning wellness therapy should be an evidence-based, no? And advice must be based upon empirical research rather than only anecdotal data. So, dili na to siya ibase lang sa mga blog, ang mga diet. Ay, keto diet, to, kay Kwani, okay ni siya, example na kay obese nga patient and they want to reduce weight. So, of course, tanaw na to kung unsa. Let's try to look at the research regarding keto diet. If it is really effective and na ba siya nutritional, wala ba siya problema sa uh, nutrition ang patient kung under siya sa keto. So, ato lang siyang i-check. No? So, inana siya. So, the physical therapist should seek out additional information as necessary and then decide if he should answer the patient's client question or refer the patient to appropriate specialist. So, inana. So, kung dili na gyud nato makaya ang mga overwhelming information nga nato na-receive from the patient o sa pag-assess nato sa iya, then he could refer that individual to an specialist, no? So, nutritionist, dietitian, dito na to siya i-refer na. So, inana siya. So, I hope that this lecture will have given you an ample knowledge regarding the wellness, no? And why it is very important for us people to have a basic knowledge of nutritional, fitness, and body composition wellness, and other branch of wellness. No? So, in a nutshell. So, our next topic will be about nutritional wellness. So, mag-focus ta sa about nutrition. And probably I will be inviting somebody during our online class to share his or her expertise regarding nutrition. So, nana. So, in one of our meetings. No? So, thank you very much and have a nice day.